Do we want to do both of them at the same time?
What about for you? Do you want amplified?
For joining us here today. My name is Liz Glynn. I'm the Director of Organizing with New Jersey Citizen Action, and we're excited to be partnering today with Social Security Works, who are here with us, and we are so glad that they decided to add Rahway as one of their stops on the Stop Taking Our Healthcare campaign. We're joined here today by speakers from Planned Parenthood, 1199 SEIU, and students for a national health program. We're all here in solidarity, along with local residents and grassroots activists, including some from Indivisible Rahway and 1NJ7. We're here collectively to lift up our voices and to hold Congress accountable. We need to call on Congress to fund our health care because everyone deserves the care that they need. So we're going to we have a list of speakers here today. Everyone will be introducing themselves. But to start us off here, we have Alex Lawson from the Social Security Works. Thank you, Alex.
Thank you, Liz. Thank you so much. And thank you to everyone who's speaking and everyone joining us today in person and at home on the live stream. My name is Alex Lawson. I'm the Executive Director of Social Security Works. And we are traveling around this country to let the people know what's going on. And what's going on is the largest theft of healthcare in the history of the world. $1 trillion stolen from us through cuts to Medicaid. What does that mean? It means that this hospital is going to close. High likelihood of closure is policy speak for this hospital is going to close. Not just randomly, because Representative Kean Jr. voted to cut $1 billion from Medicaid, along with all of the Republicans in Congress and Trump in the White House. And why did they cut $1 trillion from Medicaid? Why is this hospital going to close? So that they could give trillions of dollars in tax handouts to the richest people in the history of the world. Why? So they can buy another golden yacht to sail to Epstein's Island? This is evil that we are fighting against. But also, let me be clear, the American people are not buying what this administration is selling. The American people are fed up with politicians who only work for the billionaires and not for the people who are their bosses. And we're raising our voices together across this country with one clear message. Stop taking our health care. Restore the cuts. Don't let this hospital close so some billionaire can get a new ballroom somewhere. We live in the richest country in the history of the world. Of course, we can afford health care for everyone in this country. Of course, everyone can get a free, great education. We should have the best health care in the world. We're the only advanced economy that doesn't have guaranteed health care for all of our people already. And then they cut $1 trillion from Medicaid. The system was not delivering for the people before the cuts. So let me move it from the system and what it means for the people. Death, harm. People are going to get sicker. They're not going to get the care that they need. If your hospital doesn't close, the people who went to the hospitals that did close are going to have to come to your hospital. That means that there's going to be not enough services for everybody. Nobody is not getting hurt by this except for the billionaires. So unless you have a golden yacht, they are stealing your money, your health, all for the billionaires. But remember, we have all the power. All power is with the people. And when we raise our voices together, we will win. One person can be ignored. One voice can be ignored. But when we stand together, they cannot ignore us. And when we fight, we win. We are going to win because I've seen it. Across this country, the American people are waking up to the heist that has been perpetrated on us for the billionaires. So I want to welcome up to the stage a man who needs no introduction, John Bauman, also Bowser from Sha-Na-Na, and my dear friend and a health policy expert. So please welcome John Bauman.
And thank you, Alex. And let's say it all together. Stop taking our health care. Say it. Stop taking our health care. I am John Bauman. You might know me as Bowser from Sha-Na-Na. And for many years, I've been working on senior issues. My message today is really pretty simple. It is that whoever ends up running against Kean Jr. in the 7th District of New Jersey on election night this November has got to end up doing this. Because yes, I have made a living for over 55 years doing this. God bless America. But today I'm here to talk about a very serious subject, which is the problem that we have in New Jersey and all over America with health care. Stop Taking Our Health Care is a month-long set of series of rallies we're doing all over the country at Social Security Works to try to hold people accountable for their vote on what we call the big ugly bill, a bill that cut $1 trillion out of Medicaid, a bill that has stopped the ACA subsidies from being extended, that has cost a lot of people their health care. In fact, let me give you just some numbers. The Congressional Budget Office estimates that 15 to 17 million Americans are going to lose their health care simply as the result of the big ugly bill. 400,000 New Jerseyites are going to lose their health care as a result of the cuts in the big ugly bill. The ACA, people who are on the Affordable Care Act, have had a 174% increase on average in their health care costs. These are massive increases in people's health care. It affected everybody's premiums, and we cannot stand for this. Now, we all are standing here knowing that Representative Kean Jr. has kind of disappeared for the last couple of months. And we know that there is some kind of a health problem that Kean Jr. is struggling with. We don't know what it is. We sincerely wish Representative Kean Jr. the very best of health and the very best of luck with whatever the situation is that he's grappling with. But we also want to say very directly that we know that Representative Kean Jr. has really good health care and really good health insurance, and we wish we could say the same for his constituents here in New Jersey's 7th District. We wish the kind of health insurance, health care that Kean Jr. has, in fact, even better than anybody has in America, for everybody in this district. And in order to get there, I'm afraid we're going to have to hold everybody accountable, including Representative Kean Jr., for their votes on things like the big, ugly bill, which has ended up tearing health insurance away from millions and millions of Americans. And it's only going to get worse. There are going to be more of these kinds of votes, so we have to hold these people accountable. I will close with saying it the way Bowser might say it. So just a little doo-wop here. Bum 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 dang a dang dang a ding a dong ding. Stop taking our health care. Thanks for coming, everybody. It's great to be here with you all. And up next, I believe, is somebody that I've met and talked to on the phone, but only have met today for the first time. She is in charge of healthcare for New Jersey Citizen Action, and she is excellent. She knows exactly what she's talking about. So please welcome Laura Waddell.
Thank you. Thank you so much. Is this thing on?
It is.
Okay.
Hold it close to your chin.
All right. Thank you so much again. I'm Laura Waddell. I'm the Healthcare Program Director at New Jersey Citizen Action, and I say good afternoon, Rahway. We are standing here in the shadow of Robert Wood Johnson University Hospital, Rahway, for a reason. This is more than a backdrop. It's a symbol of what's at stake. Because when politicians in Washington decide to play games with our health care, this is where the consequences show up. In our hospitals, in our communities, in our lives. And let's just be clear, because I want to have hopefully everyone talk about how over $1 trillion in health care cuts didn't happen by accident. They were voted on, they were passed, and yes, Tom Kean Jr. and his allies chose tax breaks for the wealthy over the health and dignity of working families. And now they want more cuts to Medicaid, more spikes in Affordable Care Act premiums, more hospitals pushed to the brink of closure, more families forced to choose between seeing a doctor and paying rent. And here in Rahway, 16.5% of residents rely on Medicaid. Across New Jersey, 400,000 people could lose coverage. 70,000 have already, just since our open enrollment, because care just became too expensive. And this is not policy. This is abandonment. And while families are struggling to afford prescriptions, to afford doctor's visits, to afford basic care, what are they doing in Washington? They're pouring billions into detention and deportation. They are fast-tracking, that's right, shame. They are fast-tracking budget deals to give ICE and Border Patrol up to $140 billion more. And let me say that again, they found money for that. But they say there's no money for your health care. We say we want health care, not ICE. We say cut costs, not care. Because this is all connected. When you cut Medicaid, you don't just cut a line in a budget. You cut cancer screenings, you cut prenatal care, you cut mental health services, you cut the very things that keep people alive. When you cut SNAP and WIC, when you take food away from families, you are attacking health before someone even steps into a clinic. Healthcare is not just what happens in a hospital. It's whether a child has food to eat. It's whether a mother can afford her medication. It's whether a senior can see a doctor before it's too late. This is a full assault on our health care and our ability to live healthy, stable lives. But let me tell you something they didn't count on. They didn't count on Rahway showing up. They didn't count on New Jersey raising our voices. They didn't count on a movement of patients, workers, caregivers, and advocates saying enough is enough. We are here today because we believe something simple and powerful. Healthcare is a human right. Not a privilege, not a bargaining chip, not something you lose because of politics. So here's what we do next. We organize, we mobilize, we make noise they can't ignore. We call on every member of Congress. If your plans do not lower costs and expand care, we reject it. If your vote takes health care away from our families, we'll remember it. If you choose billionaires over patients, we will hold you accountable. Rahway, are you ready to fight back?
Yes!
Are you ready to demand a system that works for all of us?
Yes!
Are you ready to tell Washington loud and clear, hands off our health care?
Yes!
All right, thank you. Let's keep going. And let me introduce Teresa Luoni, a resident in this district. She and her family are having to navigate the devastating cuts and policy changes voted for by Representative Kean Jr. Teresa.
I got it, yeah. Good afternoon. I'm Teresa Luoni, and I'm standing here not just as a mother, but as someone living inside a system that is cracking in real time and taking human beings down with it. Right now in this country, people are being discharged from nursing homes, not because they are well, not because they are ready, but because their Medicaid funding has run out. Human beings, people with real medical needs, people who cannot care for themselves, are being dropped off at homeless shelters when their Medicaid funding runs out. Shelters that are already over capacity, shelters that were never designed to provide medical care, shelters that do not have occupational therapists, nurses, behavioral specialists, or the infrastructure to safely support people with complex needs. So what happens to those individuals? They fall through the cracks, or more honestly, they're pushed through them. So what does that have to do with me? As I watch this happen, I cannot help but see my children in that future if we continue down this path. Because the same system that's failing those adults today is the one my children will depend on tomorrow. I'm the mother of twin boys. Both of my children are autistic. My son Dylan is profoundly autistic and completely nonverbal. When overwhelmed, he engages in self-injurious behaviors. He punches himself in the head and face. These are moments where I have to step in, not just as a parent, but as a barrier between him and serious harm. I live with the very real fear that one day he could permanently injure himself. He is at risk for blinding himself during these episodes if he does not have the right supports in place. My son Max is also autistic. He's considered pre-verbal, and when his anxiety takes over, it can present as aggressive behaviors. Not because he's bad, not because he is violent, but because he's overwhelmed and cannot communicate what he needs in a way the world understands. These are not character flaws. They are unmet needs. And without the right therapies, supports, and interventions, those needs don't go away. They escalate. At their current levels of support, if services are reduced or taken away, both of my children could very easily be labeled as too dangerous for group care settings when they become adults. Think about that. Children who need support could instead be excluded from the very systems meant to help them. And when that happens, the options become painfully limited. Either I continue to manage their care entirely on my own, at home without adequate support, as they grow bigger, stronger, and harder to safely redirect, or they're placed in an institution where safety becomes a priority and the quality of their lives is further down the list. That's not a real choice. That's what happens when a system fails. And right now, my children are about to turn 14. That matters more than most people realize. because the next 4 years are not just another stretch of time. They're a critical window. This is when everything begins to shift from childhood support into preparation for adulthood. This is when services are supposed to focus on building life skills, testing and trialing job readiness, developing communication strategies, and helping them gain whatever level of independence is possible. This is when the foundation for their entire adult lives is built. Every therapy session, every support service, every intervention right now is a piece of that foundation. Every reduction in those services doesn't just make things harder in the moment, it narrows the path for my son's futures. It limits what they'll be able to do. It limits where they'll be able to go. It limits whether they will have access to meaningful day programs, safe environments, and opportunities to be a part of their communities as adults. You cannot take away services during this window and expect there to be no long-term consequences. There are, and they are permanent. I've already experienced how fragile access to care is. I spent 2.5 years on waiting lists, 2.5 years, just trying to find a psychiatrist who both understands autism and accepts our insurance. We only found a doctor last week. And when I finally found one, when I should have felt relief, hope, and maybe gratitude, that's not what I felt. Instead of thinking this doctor might help my son manage his anxiety, might help reduce the aggression and harmful behaviors that come from being overwhelmed in a world he cannot always process, I found myself thinking, how long will this last? Will this service still be available next year? Will funding changes take it away? Will we be forced to start all over again? Will my son finally be able to stabilize, only to have that stability ripped away so that billionaires can have more money? This is what healthcare looks like for families like mine. Not security, not support, uncertainty right now. And behind that uncertainty is something even harder to talk about. Many of us, in a way, are prisoners in our own homes. Because telling the truth about what life looks like comes with risk, real risk. If I say that my child struggles with anxiety so intense that it sometimes turns into behaviors that can be aggressive or harmful, people who have never lived this reality don't hear he needs support. They hear something else. They hear dangerous. They hear out of control. They hear problem. They do not see children who are overwhelmed, who are trying to communicate, who are worthy of care, dignity, and compassion. So we stay quiet usually. We manage everything behind closed doors. We parents absorb the stress, the fear, the exhaustion, because the alternative is being misunderstood, judged, or worse, having systems intervene in ways that do not actually help our children. And all of this exists under the constant pressure of living in poverty. Because caregiving at this level is not something you can clock in and out of. It's 24 hours a day, 7 days a week. It's nights without sleep. If you're lucky, maybe 2 hours at a time. It's waking up already exhausted, already depleted, already carrying the weight of everything that could go wrong. And then trying to function anyway. Trying to be hopeful and make phone calls, fill out paperwork. Maybe this will be the program that works for us. Fight for services, manage through crises, and still be a parent, a working parent. There are days when just getting out of bed feels impossible. Not because I don't care, not because I'm not trying, and not because I expect anyone else to do my job, but because the combination of physical exhaustion, emotional strain, and financial stress becomes so heavy it's hard to even stand up. And yet we do. Families like mine do it every day. But we should not have to do it alone, and we should not have to do it while the very systems that were meant and built to support us are being dismantled to give tax cuts to billionaires and send more money to support ICE. Because when healthcare is cut, when Medicaid is reduced, when services disappear, the impact is not theoretical. It's a child losing access to therapy that helps them communicate. It's a teenager losing the chance to build the skills they'll need to function as an adult. It's an adult being dropped off at a shelter that they cannot be cared for at. It's a family reaching a breaking point with nowhere left to turn. This is what's at stake. My children are not statistics. The people being discharged from those facilities are not numbers on a budget sheet. They're all human beings. My children aren't just autistic, they're human. Dylan has a great sense of humor. He loves sarcasm, gives the best hugs, and will jump in enthusiastically to help with heavy, hard work. Max is a whole vibe. This kid is artistic, creative, and endlessly curious. He's never met a piece of technology he didn't want to master. And if you asked him what his greatest accomplishment in life so far is, he would tell you proudly that it was the day that he was able to hack into his ABA Center security system and play fart noises over the intercom. They deserve safety. They deserve dignity. And they deserve a continuity of care. And families like mine deserve to live without the constant fear that everything holding us together will disappear overnight. Because it's happened in this country when they cut SNAP. It's no longer a maybe. It's happened. And we go to bed every night wondering if we'll wake up and the system that we rely on will be the next. Right now, the fear is not hypothetical. It's our reality. And people in Congress, especially members like Kean Jr., who's my House representative, have continued to vote for tax cuts to support the wealthiest people in our family and cut the care of the people in our country who need it the most. We've got to stop choosing billionaires over people. Stop choosing tax cuts and funding ICE over care for the future of our country. Thank you.
Thank you. Good afternoon. My name is Caitlin Wojtowicz, and I serve as the Executive Director with Planned Parenthood Action Fund of New Jersey. We advocate on behalf of the 2 Planned Parenthood affiliates in New Jersey and the tens of thousands of patients who seek health care and education at Planned Parenthood's 19 health centers across the state. I want to thank everyone here today for continuing to raise the alarm on the relentless attacks on our reproductive freedoms. I'm grateful to be here in such great company. We are here today because the federal administration is hell-bent on eliminating access to all reproductive health care and forcing their control over our health and our bodies. The Trump administration and congressional Republicans have cut off abortion access for our veterans, spread misinformation about mifepristone, attacked states for choosing to expand access to abortion, and pardoned violent anti-abortion extremists who incite violence outside of our health centers. And perhaps one of their most glaring attacks on reproductive health care came last summer when Trump signed H.R. 1, effectively defunding Planned Parenthood across the country. Since the Trump administration and congressional Republicans defunded Planned Parenthood, 51 health centers across 18 states have closed, leaving patients with fewer options for their essential health care. Thanks to state support, New Jersey has not had to close any health centers, but the ongoing impacts of this provision could collapse New Jersey's reproductive health care ecosystem. In New Jersey, roughly 30% of Planned Parenthood patients use Medicaid as their insurance. These attacks push reproductive health care out of reach for everyday people, making it unaffordable to access basic health care like birth control, STI testing and treatment, and cancer screenings. While the attacks on Planned Parenthood and H.R. 1 have only been levied for 1 year, we know that they will not stop until all reproductive health care is inaccessible. In January of 2026, the Republican Study Committee in the House released a framework for a 2026 reconciliation package that calls to permanently extend this provision. We must fight tooth and nail to ensure that funding for reproductive health care services will not be continued to be cut. This administration will stop at nothing to make reproductive health care more expensive and inaccessible. Even when states like New Jersey have chosen to expand access to abortion by mandating state-regulated insurance plans cover abortion, this administration launches unfounded investigations to intimidate states into following his agenda. We are in a fight for our survival, and we cannot continue to let this administration make healthcare inaccessible and unaffordable for everyday Americans. Thank you.
Hi, good afternoon, everyone. My name is Serena Hood.
And I'm Tamara.
We are here today representing 16,000 healthcare workers of 1199 SEIU of New Jersey. Our union includes CNAs, dietary aides, workers, LPNs, RNs, and many, many more who keeps our healthcare system running every day.
We represent workers across more than 5 nursing homes facilities in Congressional District 7. As healthcare workers, we are there day in and day out to provide care, dignity, and compassion to our residents and our patients. But the reality is we are understaffed and underpaid. The work is demanding and takes a toll, physically, emotionally, and mentally. That's why we're seeing, so much turnover. We care deeply about the work that we do, but we are being pushed beyond our limits.
And Medicaid cuts only make things worse. Congressman Kean Jr. voted to cut billions of dollars from Medicaid funding that our facility and our patients rely on every single day.
So you say enough is enough?
Enough is enough, Tom. We need you to stop the Medicaid cut.
We are here to stand up, to speak out, and say loud and clear, we are fired up and we are ready to get out the vote this fall as we work together to flip New Jersey's 7th Congressional District. Thank you.
Thank you.
Good afternoon, everyone. My name is Thayeba Farouk, and I am a rising third-year medical student at Rowan Virtua SOM in South Jersey. I'm a member of Students for a National Health Program and someone who herself relies on Medicaid. In a few weeks, I will start rotations, and I'm so excited to serve the patient population of New Jersey and return to the reason I chose to pursue medicine in the first place: to ensure that all patients receive the care they deserve. Medicaid made that possible for my family. My parents came to America 2 months before I was born. To make ends meet, my father worked 2 jobs back-to-back to provide for our family. Despite working constantly, he could not afford health insurance. When health issues came up, he would forgo seeing a physician, believing it was more important to continue providing for his family. Over time, that choice had consequences. His cataracts had worsened to the point that he needed surgery. However, it wasn't until the passage of the Affordable Care Act and expansion of Medicaid that my father was able to get the care he finally deserved. Thankfully, he was able to get his surgery, but due to the delay in care, he still lives with complications affecting his vision every day. My family's story is not unique. Millions of Americans across the country rely on Medicaid for access to care. No one should have to choose between seeing a doctor and providing for their family, or forgo life-altering surgery to avoid going into thousands of dollars of medical debt. Thanks to the current administration, about 1.5 million Americans have already lost their health insurance, with millions more at risk. The gutting of Medicaid and ACA credits has only worked to enrich billionaires, and now there are plans to cut as much as $200 billion in federal healthcare spending to pay for an unnecessary war. Shame. Here in New Jersey, about 1 in 5 people depend on Medicaid for their care. These cuts don't just raise costs, they take away access to care and put lives at risk. As a medical student and a future physician, it is my responsibility to recognize how political decisions can drastically shape the health outcomes of the patients that we see in clinic and to address these barriers in care. We must remind our representatives that healthcare is a human right and to stand against these cuts and protect the health of their constituents. Everybody in, nobody out.
Great afternoon to everyone, to New Jersey Citizen Action, to all the healthcare professionals here at Robert Wood Johnson Barnabas Hospital in Rahway, to all the community leaders who are assembled today, to all the members of our beloved community. I stand before you this afternoon not just as the pastor of Ebenezer, AME Church in Rahway, New Jersey, but I stand here in front of you as a shepherd who loves all of God's people. I have walked in thousands of hospital rooms. I have prayed at countless bedsides. I have held the hands of many family members, friends, loved ones, and church members who have cried heavy tears through the most difficult moments of their lives. I believe that hospitals are sacred places and spaces. I believe that hospitals are special spaces, and I believe that hospitals are significant spaces. Hospitals are spaces where faith meets fear, chemotherapy meets compassion, and healing meets hope. But in these supernatural, miraculous spaces called hospitals, unfortunately, thousands upon thousands upon thousands of people are stressed out, among so many other things, about access to affordable health care. For the past 5 years, 2 of my dear friends who live in Rahway, a husband and wife, they have gone through just a nightmare when it comes to achieving access to affordable health care. One of them has received 2 cancer scares. The other one has received a kidney transplant. Besides trying to find the right doctors and besides not being able to pay for their medicine and receiving the bad news that insurance companies will not fully cover their unexpected medical expenses, 2 of my dear friends who live in Rahway have been forced to borrow significant amounts of money from their family members, and they have to contemplate selling their home just to make ends meet. Just yesterday, the husband told me, for the music fans under the sound of my voice, in the words of the song sung by Smokey Robinson and the Miracles back in 1967, that every day he and his wife, they cry the tears of a clown when nobody is around. My brothers and sisters, we are living in a time when congressional cuts to health care are not just policy changes, but these same congressional cuts to health care have real-life human consequences. Thousands upon thousands upon thousands of good people, just like the 2 friends from Rahway that I've mentioned, they have done everything right, but their medicine and their insurance premiums are just too expensive. This is not a money issue, this is a morality issue. The Bible reminds all of us in Proverbs chapter 31, verses 8 and 9, that for all of us, we have to speak up for those who cannot speak for themselves, and we have to defend the poor and the needy. Affordable health care is not just a luxury for the privileged, but affordable health care is a necessity for every human being who is created in the image of God. When thousands and thousands upon people stand to lose their health care benefits, we must ask ourselves, what kind of community are we becoming? And what kind of community are we called to be? Decisions about health care, funding, and decisions about access to health care must be based on our humanity and not be based on our budgets. Whether through voting, speaking, organizing, marching, protesting, promoting awareness, or simply caring about God's people, all of us have a responsibility to make sure that no one is left behind. Together, my brothers and sisters, let's make sure that we hold monthly events like this one with medical leaders, community leaders, and government leaders to tackle all of these key health issues. Together, can y'all say together? Together, let's make sure that we expand community access to primary care and reduce racial disparities in hospital outcomes. Together, can everybody say together? Let's make sure that service reductions and near hospital closures do not take place, especially and respectfully in Black and brown communities as well as underserved communities. For the next to the last time, can you say together? Together, let's make sure that we provide free education, free screenings, free testing for cardiovascular disease, diabetes, and cancer with focus and on prevention and care. And for the last time, can everybody say together? Let's make sure that we diversify the clinical workforce to build trust with Black and brown communities. Today, let us all continue to choose compassion. Let's all of us continue to choose justice. Let's all of us continue to send a very strong message to Congress, because everyone, say everyone, say everyone, say everyone, everyone deserves affordable and great health care. Today is so important because healing, recovery, and prosperity is not just the work of the hospital right behind us, but healing, recovery, and prosperity is the work for all of us. Thank you so very much for the opportunity to share, and God bless all of you.
Thank you guys all again for coming out here in solidarity to fight for health care, right? We need care, not cuts. So again, thank you all. If you guys all want to come around, we'll take a nice group picture of all of us. Thanks again for everyone for joining us.
Just closing words, just thanking everyone who spoke, everyone who's watching at home, and remember that when we raise our voices together, they cannot ignore us, and when we fight, we win. So why don't we do that? When we fight,
we win.
When we fight,
we win.
When we fight,
we win.
Thanks everybody so much.
Thanks. Thank you. Kyle, did you get a good picture?